Now that we're able to receive feedback in such a timely fashion, it's allowed faculty to think outside the box in terms of what other evaluations or information they can provide their students to help them to be successful. My name is Dr. Sherry Jimenez. I am the Assistant Provost for the Office of Teaching Excellence and Assessment of Learning here at Marian University. What was slowing us down in terms of our clinical evaluations was the fact that it wasn't automated. So we were doing most of the evaluations on paper. They were rubrics, and faculty were completing those.
So the evaluations that we do are very intensive, multiple situations, multiple different times, and doing that by paper is just not practical.
Previously, when we used paper-based assessments, it would take upwards of a month to 6 weeks in order for us to aggregate the data.
Having already had a relationship with ExamSoft at my previous institution and knowing what it could do, so it got me to thinking about how we could also utilize ExamSoft for the practical aspects.
We're using ExamSoft to assess our students in several practical type assessments. So general practicals that are related to OMM, which is Osteopathic Manipulative Medicine. We also structure OSCEs, which are objective structured clinical exams, and those involve standardized patients as evaluators in addition to our faculty. And then we have our simulations, which are in our simulation center, and those involve faculty but not the standardized patients. So many of these assessments can be applicable to other environments as well. Pretty much any clinical type assessment where students can be observed in a specific setting that would be similar to what they would experience in professional practice.
What the clinical evaluation tool has primarily helped us with is providing feedback in real time to our students and our faculty.
When students don't get feedback soon enough, particularly if the feedback is delayed until just barely before the time of their next activity, it's hard to expect them to actually have time to improve or work on things.
Because it allows feedback to come so quickly to our students, it also allows our faculty to now be a little bit more innovative in regards to the types of assessments that we're doing. So one of the new assessment types that we've decided to run is post-OSCE, which is the objective structured clinical exam. Our students will receive feedback from the standardized patient almost immediately.
So clinical feedback is essential, I think, because even though you're working with an actor or somebody that may not be a patient, their opinion of you, the things that they see that you do, they're going to be on the keep their eye out for mannerisms or repetition or maybe nervousness or just kind of how you sit and act. If you missed something, if you're awkward doing something, if you can get that sort of feedback.
The one thing that the clinical evaluation tool does best for the simulation center is allow feedback to immediately be given to our students, grading on site, and accurate information so that they are able to synthesize the information and put it into practice.
What the clinical evaluation tool has helped us the most with is
immediate or quick feedback.
Allows us to customize our assessments.
Accurate information.
Convenience.
It's allowed them to think outside the box in terms of what more they can be doing with their performance data and what other evaluations they could perhaps design and provide the students in a way that would help them to be successful.